Welcome to our American College of Obstetricians and Gynecologists Oral Video History Project. Today we're very fortunate to have with us Dr. Rudi Ansbacher. Rudi, thank you very much for being here.
Pleasure to be here, sir.
We'd like to talk to you a little bit about your career and some of the aspects, but before we start, let's talk a little bit about you. Tell me, where were you born?
I was born in a town called Sydney, New York, upstate. It's about 10 miles from Cooperstown.
And where did you go to school?
Grade school was actually we moved to Long Island, and I went to grade school in Rockville Center, Hewitt School, for 7 years, missing the 4th grade because my father said I didn't need to do that. And then he decided that I didn't need the 8th grade, so he sent me to a small school in Syracuse, New York called Manulus. And since he then had moved to Indiana, I ended up doing my last 3 years of high school at Culver Military Academy in Culver, Indiana, where I learned to play polo by learning how to ride and training my own horse.
You were all over the eastern part of the country.
That's about right.
Where did you go to college and university?
When I finished Culver in 1950, I went to Harvard University in Boston at the age of 15.
You must have had quite an academic record to go into Harvard at age 15.
Yeah. And unfortunately, I turned 16 a month later, and my parents were divorced. And at the end of the year, my brother, who was also at Harvard, my sister was at Radcliffe, we couldn't afford to pay the bills, and we all dropped out. My sister went to work on Long Island. My brother got drafted, Korean War. And since I was only 16, I went to work in New York at a insurance company on John Street off of Wall Street. Worked there a year. And after a year, I said, you know, there are 2 types of people in New York who work. Those who want to get ahead and those who sit and get their paycheck. And I decided I need a college education to finish, to be one of the former people. So my Culver's roommate's father, I had helped him academically at Culver, actually called me and said, if you go to VMI, Virginia Military Institute in Lexington, Virginia, I will pay your first year as a sophomore rat at VMI if you will help my son academically there. So I jumped at the chance, left the job in New York, even though they promised me $150 a week not to leave in 1951, which was a huge salary. Took a bus down to Lexington, Virginia, walked on the campus after we passed Washington Lee, which is a beautiful campus in Lexington, Virginia. Saw the parade ground at VMI and the structure, which looked like a prison. And when I entered it, I became a rat, and for the first year it was very, very difficult. But fortunately, academically, I finished that sophomore year, and we paid the tuition and board off with my father's life insurance, which we traded in. And the last 2 years there, even though I made cadet lieutenant, which is very unusual for a 3-year person, I waited tables and worked in the PX at 75 cents an hour. And when I left VMI, I had $300 in the bank. $100 for each of the years I was #1 in the pre-med class. I had orders to go to Fort Benning, Georgia as a 2nd Lieutenant Infantry in when I graduated in 1955. And because my mentor and academic leader in biology pre-med at VMI said, you know, you didn't get in medical school because you applied only to Columbia. And the previous year, the cadet who went to Columbia flunked out medical school. So they put me on their wait list. So on Memorial Day of my senior year, after I just had appendicitis during exam week, he personally drove me to Virginia, University of Virginia, where I interviewed on the holiday. And on the 26th of June, I got my acceptance to medical school, knowing I had orders to go to Fort Benning on the 1st of July. And I decided to pick up the telephone. I called the Pentagon, talked to the person in charge of the physicians, and said, I just got accepted to medical school. I'd love to have a deferment. And they gave it to me, which was very unusual. So I went 4 years to the University of Virginia Medical School, interned there for a year, and then because of the Berry Plan, which all doctors were conscripted to 2 years of active duty when they finished either internship or residency, or could leave during residency and do the 2 years. Since I was making $25 a week as an intern, not very much, we had a raise to $50 in April of the next spring, which still didn't cover my expenses. I decided to go on active duty as a captain, United States Medical Corps, Army Medical Corps. Was stationed in the Quartermaster Depot south of Richmond, Virginia, just north of Fort Lee, Virginia, which was an Army base. And for 2 years I spent there doing general medicine, but I was an induction physician. So during the buildup of the wall in Germany, in Berlin, I was examining up to 150 to 200 men a day for enlistment into the Army, Navy, and the Air Force. And because I was so strict doing exams, I had the nickname of Dr. Reject from all the recruiters, which I thought was very interesting because they always made their quotas, even though I would reject because of what the standards were to be on active duty. I even picked up a testicular cancer while I was doing exams, which is most unusual because I don't think many people would look at the genitalia or feel them. And I got a commendation from a senator because I had done that from his family, which I thought was interesting. So I applied for residency in OB-GYN at that time. And by the way, the reason I was always interested in OB-GYN, I always loved to see things grow. And when I was a youngster, we never had any flowers, and I could go to the neighbor's house and pull the flowers and plant them in our garden. But Ralph, they didn't grow because I didn't have the roots. They all died. So ever since then, I've been interested in growth of things, and I always was interested in take care of women. Did a lot of that when I was on the base for that 2 years. Also was their veterinarian. Did a few operations on some of the cats and dogs and things like that to keep my hand in. And at the end of the 2 years, actually at the end of the 1 year, because of the Berlin Wall, I had applied back for residency to in Ann Arbor, in Charlottesville, Virginia. I can't think of his name right now, the chairman of the department. He wrote me back and said there's a war in Berlin. And what you must understand is during World War II, he served with Cato Drash, a thoracic surgeon for Virginia, as a Virginia unit doing surgery in World War II in Germany, which I thought was very, very interesting. Norman Thornton was the chair, excuse me. And I wrote Norman back a letter. I shouldn't have, but I did. I said it's spelled W-A-L-L, not W-A-R. And he never forgot it. He decided to follow my career the rest of the time, and which he did. But I then personally took a trip to Washington, D.C., to the Surgeon General's office and said, what I'd like to do is take a year of general surgery, 3 years of OB-GYN, then go into academic medicine and do some research. And they outlined me a 18-year plan and said, as long as you follow this plan, things will work out well. If you ever get a lateral assignment, you've had it. If you ever get a bad OER, you've had it. Get out. So I followed that plan. After my 2 years at the Quartermaster Depot in south of Richmond, Virginia, I was accepted for the pre-specialty surgical year at Fort Bragg, North Carolina, for a year where I did everything but OB-GYN and learned an awful lot, including how to do appendectomies, a couple gallbladders, lots of orthopedic surgery, because at that time the Cuban War, the war crisis came up, and I was one of the 2 doctors who was left on the base with a mentor, and we saw everybody because the rest of the military physicians had gone down to Florida, massing for the Cuban crisis. So I learned an awful lot that year, including infectious disease, because I had a month on an infectious disease ward. And then I had my residency at Letterman Army Medical Center under Bill Boyson, who became a 2-star general. And Bill Boyson was extremely adept physician, surgery with vaginal surgery. And I learned vaginal surgery like few other people have learned it. And having had a year of general surgery, I was sort of ahead of the other residents at Letterman during this time. And I finished my residency in 1966 and was assigned to Okinawa by Ed Zimmerman. And he made the assignments at Armed Forces district meetings. And I remember Ed took 3 of us to his personal bedroom and said, talked to us for half an hour, and then talked a lot to the other 2 gentlemen, and finally looked at me and says, "By the way, Ansbacher, you're going to Okinawa." I said, "Thank you, sir, but I have a question." And actually his question didn't come till later, so I'll get there that later. So I went to Okinawa and worked under someone who was practicing actually pre-Second World War OB-GYN, who didn't believe in doing the amniocentesis for RH disease and wouldn't let us do amniocentesis, wouldn't let us do insertions of IUDs, which has just come out. But he let the corpsmen do that, and we took care of the complications that the corpsmen had. So I didn't get along too well with he was also regular Army, and he did not write me up very well on the efficiency reports because I was a threat. And fortunately, our hospital commander, Bill Cox, was kind enough to pull my OERs and write the OER for me instead of turning in, I won't mention the person's name, OER who did it. And when he was reassigned head of the Department of OB there, OB-GYN, I was told I'd become the leader of that department. But Warren Otterson came in about that time. Warren outranked me by a year. He had done a lot of family practice and then taken his residency. So he outranked me by a year, and he took over, and I was very, very depressed because I had not become the chair. But Ed Zimmerman made a consultant trip to Okinawa. And the reason I brought up vaginal surgery is he said, "I want to see how you operate." So I did a vaginal hysterectomy in 35 minutes with the assistant. And then he called me to his room. He said, "You know something? What would you like to do with your career?" I said, "I'd very much like to do some research and do academic medicine." He said, "Okay, and how come you never decided to come to Walter Reed?" I said, "Sir, I put it number 1 as my first choice, and you didn't accept me. I got my second choice, which was Letterman." He looked at me and said, "Okay." And 3 months later, I got a letter. He said, "We're curtailing you from your obligation in Okinawa to take the school at Walter Reed Army Institute of Research, which was an allied medicine and military science course." And we had 10 in my class for 10 months to learn all about how to do research, including basic design of experiments, statistics, having people come in to teach us all these things before we took the fellowship, which I was granted at Arbor with Dr. Jan Beerman in reproductive medicine, biology, and endocrinology and infertility. And the reason I wanted to go to Ann Arbor was because Jan Beerman and Bob Kistner from Boston had just written the book Progress in Infertility, which was the Bible of infertility, and I was always interested, as I said, in seeing things grow. And I said, what better way to do it than take couples that can't have babies and see if we can't help them to establish a pregnancy and make it to term. The year was very good at Walter Reed. I enjoyed it. And then we left there and went to Ann Arbor for 2 years in reproductive biology, endocrinology. where since I had to take some coursework, I said, why not take it for credit? So I picked up my master's degree while taking the coursework, wrote back to the Army and said, you know, you gave me 2 years, can you give me a third year so I get my PhD? They said, no, we can't do that. We gave you 2 years, but not the third year. And the reason I brought up Warren Ottison's name, and unfortunately he just passed away about 6 months ago. Warren was at the Chiefs meeting. Guy Plunkett was the chairman at Brooke Army Medical Center, and no one wanted me because they thought I was too outspoken and talked what I believed in. But Warren said, no, you take this guy, he's good. So Warren saved me because I went to Brooke Army Medical Center as not their vice chair yet, but I did as a faculty person. And I set up the entire research unit for Brooke Army Medical Center. It was the only Army medical center that did not have a research division at the time. Got a Legion of Merit, both a Meritorious Service Medal and a Legion of Merit for that. And then when Warren took over, when Guy Plunkett retired, I became the vice chair of that department, still ran the research unit. And in 1977, I got a call from the person who replaced Ed Zimmerman, saying they needed a chairman at Letterman Army Medical Center, San Francisco. And they asked me if I would like to take that job. I said, I'd love to take that job. That's why I trained as a resident. The problem was the chief resident there outranked me by 2 years and was still there. And he and I never got along because I had challenged him once about a case he wanted to take to surgery and had the audacity to put a stethoscope on a woman's abdomen and hear fetal heart beating, and said, I don't think we should take her to surgery. So they made a switch. They brought that person to Brooke while I switched and went to Letterman as the chairman there, where I worked 3 years with Jim Woods, who's now chairman at Rochester. He was my maternal fetal person. And Dikran Shamlian, who was sort of a GYN specialist with an interest in GYN oncology and pathology. And the three of us trained 8 people, 2 interns, 2 second-year residents, 2 third-year residents, 2 senior residents. And I replaced 2 people when I got in there, and 3 years later, which would be my 20th year, when I retired, they replaced me with 3 people. And I would have stayed on had they given me, at that time they were considering a star rank for what they call a brevet general, who was an academic person teaching at academic centers. And of course they didn't do that. And when they said they weren't going to send me any replacements to help me with Dikran and Jim, I said, that's it. But they asked me first to take a recruiting trip back to Ann Arbor and to recruit people in Michigan for the military. So I had a week TDY to go through Wayne County Wayne County Hospital and Wayne State University Medical School in Detroit, University of Michigan, and also Grand Rapids, where Butterworth and Blodgett hospitals were, to recruit people for the Army. And I ended up reverse recruiting myself back to Ann Arbor because they remembered me when I was a fellow there during my 2 years, and they had an opening. And I got recruited, and they never gave me a supper, never gave me anything for it, but I still got recruited back. And fortunately, I was a full professor when I went on staff there in September of 1980, because I had over 50 publications during my military career, which my first publication came out of Letterman as a resident. And when that came out, all the other residents say, hey, that's fun, your name's in print, we should do it too. And from then on, I always thought that residents should be at least producing one article, should be published during the time they were residents, do some research, present it, and publish it. So in the last 34 years, I've been the staff at the Department of OBGYN at University of Michigan Medical Center, which is now University of Michigan Health System. I spent 21 years actively practicing. Didn't give up obstetrics till 2001, which was my last delivery. And the faculty always said, how come you did it so long? I said, because I enjoyed it. I loved OB. Gave up surgery that year because the only way to retire or to become emeritus was to give up surgery. So I phased down my surgery and also gave up surgery that year. After 21 years on the faculty, I became Professor Emeritus of OBGYN. And what I do now is worthwhile talking about, I think, because in 1980, when I went to Ann Arbor, they had absolutely no mentorship for any of the residents. And I said, you know, this is wrong, because these people are trying to find their way through residency. They have no real support. So I set up a program where all new residents would have 6 months professional guidance of mentoring by the resident program chairperson. After 6 months, they had a chance to pick on the faculty who they wanted to be their chairperson and their mentor through the rest of the residency, the rest of the 3.5 years. And we only had 9 faculty at that time, and it's always fascinating because residents know who are good mentors and who are not good mentors. They pick someone who they could work with and was a good mentor. I put a sign in my office at that time that said, what you see here, say here, stays here when you leave here, which they knew that if they talked to me about anything from family affairs or difficulty with different people or problems in their academic life or problems in their research life, would never go out of the office. So I've been mentoring people ever since that time. And what's fascinating about that story is that Bob Cephalo, very good person who retired from the Navy the same year I did from the Army in 1980 and went to University of North Carolina as a maternal fetal medicine expert and their division chair, later became acting chair at UNC 2 or 3 times. What was fascinating is he was the co-editor of the OBGYN survey, and in an article said, oh, where are all the mentors? And I wrote down in a letter, sent him back, I said, we are here, but we're behind the scenes. We're doing what mentorship should all be about. He said, please, have you written this up? I said, certainly. He said, send me the article. It was published 3 months later in the OBGYN survey, and since that time I've had 3 publications on mentorship. And the reason I'm so adamant, because in the military, when they did officer efficiency reports, they never talked to you about it till after it was published. So you never knew what they wrote about you. And if there was anything adverse, your career was ended. And I made a decision because of that. Whenever I evaluate anybody, I would sit face to face with them like you and I are sitting right here with nothing between us, so we're on the same level, and talk about your good points, which I write about, and talk about what I want you to do in the next year to improve yourself.
Interesting that now that's become a very significant part of most training programs. Let me ask you a question. Change the topic a little bit. When did you first get involved with ACOG?
I guess it was probably after I finished residency, actually. I was a junior fellow. And we had a very active part in doing certain things for the Armed Forces District meeting. The Armed Forces District meeting was one of the sections of ACOG, highly respected for outstanding meetings in the fall. And we put on the 1975 meeting. The first one I attended was when I was a second-year resident, when Bill Boyson was the chairperson at Letterman in 1963. So that's the first time I attended a ACOG meeting. But we put the meeting on in 1975. Warren Otterson, who was the chair at Brooke, and I was the vice chair, and I did the program chairman. I was a program chairman, and it was a great meeting. It was the first time we did television from a distance, active television, a real surgical operation that we showed during the meeting. It's the first time that happened. And there are a lot of innovations the military have done to help everybody. I mean, if you look what's gone on at Walter Reed with recently with amputees and what they've set up at Walter Reed, which has become a heralding product with the spaceships that we've gotten all the information from the people that went up in space. But the military has been active in the burn unit at Brooke when we were there, And I learned a lot in research from them too while I was at Brooke. So I guess it was 63, the first meeting I attended. And from then on, I got very interested in college activities. And in 1976, I was appointed as the first Armed Forces District representative of the Green Journal editorial board, which I thought was really nice. And I said, what an opportunity. So I represented the Armed Forces District on the editorial board from 76 to 80. And the second thing that's important here, in 1980, I actually they were trying to recruit me to go back to New York, and this is a story I've got to tell you. But having been born and raised in New York and worked in New York and having two teenage children at the time, actually teenagers not ready to go to high school yet, I decided New York City was not the place I wanted to go, so I said, I'll be happy to go to New York, you pay me $1 million a year, and of course I priced myself out of the market. But then I was again requested to go back to New York in 1984, 4 years after I got to Michigan. And I said, the price is up, it's up to $3 million now, and I still priced myself out of the market. But I looked around at other chairs, but most of them, as we called them, were toilet seats, not real chairs. While I was in Ann Arbor, of course, I think you may remember, I was acting chairman when they got rid of one chairman in '84. Then I became interim chairman and got rid of another chairman in 1989. So I've had the opportunity to run that department 4 different times. But I don't think I answered your question, because I forgot it.
No, you got involved in ACOG early on.
Okay, so I got involved in ACOG.
What positions have you held in ACOG?
Well, I was secretary of the Armed Forces District, and really would have liked to have become chair of the district, but I got blocked by that because I retired in 1980. Had I stayed 1 more year in '81, I'd probably been chair of the district. So I missed out doing that. But I then fortunately was asked to be on the scientific program committee by the college, which was 7 years of just absolutely, I enjoyed it so much. They set up the annual program, annual clinical program for the college in different cities. And I had the fortune to not only go 5 years, but the 2 added years. So I was scientific program chairman for the meeting in New Orleans in '86 when ex-Governor Love was our prime speaker. And in 1987, I was the overall chairman when the meeting was in Las Vegas. And to have the chance to meet so many of the different, I won't say characters, but I'll say different personalities we had in OB-GYN throughout the country, and be able to utilize their talents teaching others was just a pure joy for me to try to organize.
Rudi, you've been very active in education, very active in recruitment of students into OB-GYN. If a young student came into you today and said, I'm thinking about a career in OB-GYN, what would you tell him or her?
Interesting. Last Saturday, I was part of the Second Look weekend for high school students, for college students interested in going into medicine. And they had already applied to different medical schools around the country, and I had 8 of these senior college students sitting around a table, and we talked about medicine, almost exactly what you're talking about. And what I explained to them was the satisfaction of being a physician, being able to take care of people, their problems, their families. It's like having a family, a second family. It's very rewarding, and there are many more ups and downs, even though sometimes you get into situations that are obviously ones that you maybe had no control over, that just didn't turn out well. And the highs just so much beat out the lows that I look back at my career and I say, the 2 things you can do in your life is what you leave your children and what you do for other people. And I think that pays off in the long run.
I think we would all agree with you. OB-GYN is that type of specialty.
That's exactly right.
What you didn't mention is that when you took over the scientific program in New Orleans, you had a young physician that came to join you, and that's where you and I first got together.
Yes, sir.
And you were a superb chairman, and that was a superb meeting.
Thank you.
You did very well.
Thank you,
I want to
sir.
thank you for coming here today and sharing yourself and your experience with us. You are truly one of the solid pillars of the American College, and I really do appreciate it. And thank you very much for being here today.
Thank you, sir.